The Laupus Library Diversity Committee welcomes you to the virtual panel discussion, Community Care, When Self-Care is Not Enough. We're so glad you have joined us to discuss this important topic. At this time, I will read the North Carolina Land Acknowledgement. We acknowledge the Tuscarora and Catawba people who are the traditional custodians of the land on which we work and live. We honor these tribes by recognizing that our institutions were built on land stolen from those who were here before colonizers arrived. We pay respect to 8 recognized tribes: Cohari, Eastern Band of Cherokee, Haliwa Saponi, Lumbee, Meherrin, Occaneechi Band of Saponi, and Waccamaw Siwan, all nations and their elders past, present, and emerging. Additionally, this land has borne witness to over 400 years of enslavement, torture, and systematic mistreatment of African people and their descendants. We must acknowledge the history of our spaces and the places that we occupy to both understand and unlearn the many ways that we have been socialized. Now, just a minute for tech highlights. You can react to the panelists' response or attendees' questions by clicking on the reaction button. You can ask questions. Now it says through Q&A, but actually you ask questions through the chat today. We were having a little issue with the web version of Teams not allowing the Q&A, so we'll just use the chat for questions today. When you're ready to leave, you can click the red leave button when you're ready to exit the webinar. Our panelists today, and I'm going to introduce them. Our panelists today are, first, Christina Bowen, MD, has been practicing as a family medicine physician in her community for over 10 years. She began her leadership experience as chief resident at Carolinas Medical Center for the Family Medicine Residency. Dr. Bowen was asked to continue in Charlotte and serve as a faculty member for the Family Medicine Residency after completion of her training. Dr. Bowen moved back to Eastern North Carolina to serve the rural communities in which she grew up. While living in Eastern North Carolina, she has practiced integrative primary care with a focus on her patients' emotional well-being and the impact on their physical diagnosis. Dr. Bowen has also served her community over the last 10 years as the medical director for the Dare County Department of Public Health, where she is engaged in public health initiatives for her rural community. The National Organization of State Offices of Rural Health recognized Dr. Bowen as the first North Carolina recipient of their Community Star Award in 2020 for her work in Dare County. She has assisted in leading employee well-being initiatives for ECU Health and ECU Health Medical Center as the medical director for the Office of Experience. Over the last 3 years, Dr. Bowen has led and partnered with others in the organization to support well-being and experience of team members with an emphasis over the last 2 years on supporting team members' emotional well-being. Dr. Bowen accepted the position of ECU's Health's first Chief Wellbeing Officer in January of this year. Dr. Jennifer Matthews earned her doctorate in health education and health promotion from the University of Alabama and the University of Alabama at Birmingham Public School, School of Public Health. She is currently a professor in the Department of Health Education and Promotion at ECU. Her research focuses on the impact of trauma and resilience on substance use. Dr. Matthews' current funding includes the Drug-Free Communities and the CARA grant from the CDC, providing support for the Pitt County Coalition on Substance Use in preventing underage drinking and opioid misuse. She was a founding member and currently serves on the leadership team for the local collaborative BRACE, B-R-A-C-E, that seeks to address trauma and resilience in Pitt County. She also volunteers with PCCSU, serves on Pitt County Juvenile Crime Prevention Council, and is a certified community resilience model trainer. Dr. Matthews has co-authored papers in such journals as Journal of American College Health, Journal of Addiction Medicine, and American Journal of Preventive Medicine. Tamra Church MAEd MCHES certified CRM teacher, is a faculty member at East Carolina in the Department of Health Education and Promotion, and the Talk It Out NC Ambassador for Eastern North Carolina. She is a certified community resilience model teacher, CATCH, Catch My Breath community trainer, community action poverty simulation facilitator, youth mental health first aider, and is trained in the Strengthening Families TM Protective Factors framework. She serves as chair and executive director for the Coastal Coalition for Substance Awareness and Prevention, and is the principal investigator for the Drug-Free Community Support Program, overseeing grant activities. She leads the CCSAP Resilience Collaborative, co-chairs the Resilient North Carolina Collaborative Coalition, and is a member of BRACE and Colleges and Universities for Resilience. Dr. Erin Ness Roberts is the clinic director of the ECU Family Therapy Clinic. She did her Master's of Science in Social Work, Marriage and Family Therapy, and her PhD in Social Work at the University of Louisville. She is licensed in Marriage and Family Therapy in North Carolina. She has published research on youth functioning in the co-parenting context, empowering unmarried parents for success, and communication partners in intimate partner violence perpetration and victimization. She received the Outstanding Leadership and Innovation during the COVID-19 Pandemic Award in August of 2020. Mohammed Hassan will be our facilitator today. He is a student worker with Laupus Library. He's also a senior at ECU studying nutrition and dietetics, and he's planning on working in food and nutrition science when he graduates. Now, Mohammed, I'll turn it over to you.
Hey everyone, how's it going? So to start off with, we will ask all the panelists some questions, and number one we'll begin with is we tend to hear a lot about self-care, but what is community care? And I'm going to direct this to Dr. Church to start off with.
Okay, so I have to share. It's Miss Church, so I just don't want to misrepresent myself here. Hi, everyone. Thank you so much for joining us today. So, yeah, we hear a whole lot about self-care these days, right? And so not as much about community care. So while it's important for us to take time to practice self-care, community care is really focused more on the community and supporting one another within our community. This can be an online community. It can be the physical space in which you work in or which you live in. But it's really about the community coming together. It can be sharing ideas. It can be sharing resources. It might be, creating relationships with your neighbors whenever you have times of need in which you can reach out to those neighbors. And so whenever we think about community care, this can be on both the micro and the macro level. It can be something that we do just for people that are within our close network. It could look like cooking dinner or swapping clothes with a neighbor or being there in times of need. It might be asking for help or offering help whenever you see that a neighbor or community member, a coworker is in need. But then on the micro level, it's more around things that we can do within a community, maybe a community clothing swap. It might look like volunteering your time or hosting a community gathering, creating digital spaces too online where you can share resources, where you can connect with one another. A lot of times I think about community care as a chain. Most people that know me know I will say we are only as strong as our weakest link. So while there's been so much push on self-care, not recognizing that there needs to be a community to support individuals can be problematic. And so really it's moving us closer to this kind of idea of a collective collaborative effort to be healthy and to be able to live lives and to thrive within our communities, because none of us are siloed within our own little sphere of existence, shall I say, and especially for marginalized communities where people are having to navigate the systems that are in place and to really navigate white supremacy and the ways in which it shows up in spaces and in systems. So really being able to tap into the resources, restorative care, among others, and to learn to love one another is really important for us to be able to pull together our assets and our support and our resources. And that includes time. So I will step back and let someone else share.
Thank you so much. That was wonderful. Thank you for sharing. So for the next question, this time we'll start with Dr. Matthews, is how are you involved in promoting community care at ECU and beyond?
Good morning, everyone. Like Ms. Church, I'm also a community resilience model trainer. So I think that a lot of what I do in working with the organizations, both the Substance Use Coalition as well as BRACE, the Trauma and Resilience Coalition, we do a lot of things on campus, and that includes some of the resiliency trainings. It includes educating people about what resilience and trauma-informed care looks like, or a trauma-informed classroom. We work with schools, knowing that children, they spend the vast majority of their day in school as a system, and they need care as a community, and that smaller community there as well. So helping them understand, I guess, the collective impact that adversity can place on individuals, but how that impacts the system as a whole. And I feel like in general, public health lends to this community care model, in that the focus is on the entire community rather than like an individual. And so, just providing some of the public health expertise and work that I do within the communities are all examples of sort of promoting some of that community care.
Thank you. Thank you so much for that. Next up, we'll ask Ms. Churchiden for her input, and then after that, Dr. Roberts would be more than welcome to answer.
Yeah, so we've done a lot of book clubs. I volunteer a lot. I give my time probably too much. I should share a little for myself sometimes, really trying to figure out that work-life balance and that service balance. Just building connections. We're in such a digital age nowadays. Sometimes it's almost like pulling teeth just to get someone to have a conversation with you. But, really making that effort to go above and beyond when I'm in my local post office, to make a connection with a neighbor that might be 3 doors down that I normally don't see. Stopping by whenever I'm on a bike ride to check in on the family that just moved in 4 doors down, to make sure that the kids are enjoying school, and, do you need anything? Sharing knowledge within my community. Also as a CRIM teacher, just providing those CRIM workshops to help people learn regulation skills, but also helping parents to understand how they can co-regulate with their children, but also with each other. I live an hour south, so I'm in Jones County, where we, like many other counties here in Eastern North Carolina, were devastated by the floods a few years ago, and sometimes continuously. And, just checking in with my community members, making sure that they're okay, recognizing whenever it's hurricane season that they're pretty activated themselves, and, trying to guide that conversation to help them think about how they're preparing and how they're getting through their days, to not be so stressed out even thinking about that. We offer a lot of other different types of classes for parents, and, really just helping our community members to, I would say, be the best that they can be. So those are a few ways that we do it.
All right, and I'm Erin Roberts, and I'm the clinic director at the ECU Family Therapy Clinic. And so at the clinic, we have a lot of things where we are working with the community. The Family Therapy Clinic has been working with the community for over 30 years now. I've been here for 6 years of that, but it's a student training clinic. And so we have clients from all over the community that come in. We really try and make sure that clients are able to be seen in whatever kind of medium they're able to be seen in. So if that is telehealth, we have telehealth, we have in person, and we see individuals, couples, and families. And one of the pieces that I think that we as a group have really concentrated on is the impact of trauma on the general community. And so when I arrived about 6 years ago, we kind of did a general survey of the clinic and found that about 60% of our clients had experienced a major form of trauma. And so focusing and shifting that into sort of some trauma treatment. I think, as far as community care, recognizing that not everyone, right, has experienced trauma, or not everyone has had the same manifestations of trauma or the same impact that trauma has had. And so, therapy might not be for everyone. We have kind of expanded to work a lot with Ms. Church and Dr. Matthews in the community, heavily involved in Embrace and helping kind of the community and working together with other professionals. And I think that is a big piece too of community care, is kind of that we all, rather than the you or the you all, is including all of us kind of within that we. Because I think one of the things is, if we, start to say, hey, like, what you really need to do is, how is your self-care and how are you incorporating that self-care in your life, that, for someone who barely has enough energy to kind of keep going throughout the day or get through those days, being able to, like, oh gosh, well, this is another thing that I'm just not doing, can be really hard. So including that we all in some spaces. And so one of the spaces, like, we have incorporated that in is just even within our clinic admin team and within our therapists, and having meetings where we get together. And yes, we talk about business, but we also have that time where we are getting to know one another. We're talking about things that, a movie that came out, or something that is not on business as usual, forming those relationships, because I think that can really help with building that community care. So that's a little bit about kind of what we're involved in.
Thank you. And finally, Dr. Bowen.
Yeah, thank you so much, Dr. Roberts. That was a great segue into my notes I've been taking as I listening to you all speak. At ECU Health, starting out early on in my role, we really did focus some on well-being and individualized well-being. And quickly we recognized that when we think about creating a culture of well-being, and to me, that's creating a community of well-being where we all thrive, that it's really relationship based, and the recognition that we're all human beings coming to work with our own stories, and really creating a space for us, as you were saying, Erin, to share those stories and really appreciate our differences and highlight those, because that does make us stronger. And so we really have been very intentional about psychological safety and what that means to create a psychologically safe environment, and why that's important for us to create that community at ECU Health, and how that impacts us as a community of team members working to take excellent care of patients. And the thing that I love when I was thinking about this talk is that I'm pretty passionate about Eastern North Carolina, having grown up here, and my entire family lives here still. We are one of the biggest employers in Eastern North Carolina. So I get excited, and just listening to you all, I'm very familiar with the CRIM model. All of this to me is just this beautiful ripple effect of us taking care of the broader community of Eastern North Carolina, and basing it on relationship and highlighting our differences, and really bringing those to the table as a wonderful way for us to actually come together and appreciate one another as human beings, and appreciate one another's stories. And so we're very intentional about doing that at ECU Health for each other, our community of healthcare team members, and for our patients. So really intentional about listening to stories.
Thank you so much. That was wonderful. Now we'll be moving on, and we'll be asking each individual panelist a couple of questions about their work with community care and each of their roles. And to start off with, we'll start with Dr. Jennifer Matthews. And I'd like to ask, what does the role of public health and health education play in community care?
I feel like Dr. Bowen has a degree in public health as well, because what that she described is exactly what public health is about. Public health is, when I talk to students about, the difference between public health and, medical, what the traditional medical treatment, it's looking at an individual in a medical treatment versus a population as a whole, but also looking at what can we do to prevent things from happening in the communities. It's trying to go further upstream, knowing that we do have issues that need to be treated. I don't want to downplay that, because obviously that's extremely important. But if we continue to treat, we can't treat our way out of anything. We have to go further upstream to figure out what's going on in our communities that's contributing to some of those some of the healthcare issues that we're seeing. So, when you're looking at poverty, homelessness, food insecurities, I mean, all of these social determinants of health, which is a pretty big buzzword around, but we've been studying that in public health for decades. And so it's really just owning the fact that there are issues that we need to address within our community, and what can our community do to help individuals thrive within them. So knowing that adversity exists and that not everybody's life is going to be perfect or whatever cupcakes and rainbows looks like to individuals, it's really knowing that that adversity is going to be there, but does the community provide a soft space for it to land? Like, are there supports? Are there things that different sectors can do to come together? And that requires us to work beyond silos and work with each other. And I know that no matter what sector you're in, you hear this all the time. But public health really does operate that way. You look at a health department and the different pieces that are together in that health department. That's pretty much the epitome of how public health operates. I don't always think that public health has had the appreciation that it deserves. And a lot of that is the way systems are set up, unfortunately. But, you also have the opportunities that you can bring together and make, in a way, build those relationships that I 100% agree are really what makes a community function in a way that presents care. You have shared resources. We don't have a lot of resources in public health, so we get real creative and start working with different partners to try to get things done, and that builds those relationships, which then again allows for that care, that community care, to continue to exist. And it also makes it more sustainable. It provides and sets up a model that allows for, sure, it might be one issue that we're brought together on for this specific day, but that one issue can then lead to other issues, which can lead to other relationships and other programs and things that are established that can help, again, make that pillow where that community exists, makes that pillow a little bit softer, so that when people do experience adversity, again, they have community support in place to help them.
Thank you. Next question, it would be for you, is how does your work with community outreach and prevention intersect with community care?
I'll use one specific example just because it's one of the things that I'm very proud of. I've done a lot of work with the Substance Use Coalition here in Pitt County, and for a little bit of time served as an interim executive director when they were in between executive directors. And I helped them write a COVID grant, or a grant with COVID money, a couple of years ago, and it's actually partnering with Dr. Roberts at the Family Therapy Clinic. And in that grant, it's called the Thriving Families Program. In that grant, we basically set up a system to help bring supports together for individuals who have a substance use disorder, or who live in a home with somebody who has a substance use disorder and or mental health illness. And so it provides them connections to, say, parenting skills, if that's something that they need. It provides resilience training, some resume building if you need help in that area. I mean, so and it's not, there's a circle of security, which is again about connection and family parenting, but it's not about like the Substance Use Coalition actually developing these trainings, it's utilizing what already exists in our communities to provide those connections. And the money actually from the grant has provided an opportunity for individuals to receive up to $25 in gift cards per training that they attend or per educational session that they attend. So there's financial incentives for them to complete that as well. But again, it's not about like, I mean, it wasn't at all. And I had a hard time selling this to the state. We aren't developing anything. We aren't developing any trainings, any curriculum. We are bringing together the resources in the community. And I feel like that's a pretty good example of where a lot of my research and work has led. I'm very community based. I do a lot of work in my immediate community. And I feel like that is sort of how I have operationalized a lot of the community care and research that I conduct.
That was wonderful. Thank you for sharing.
Sure.
Next up, I'll be asking Ms. Tamra Church, how does community resiliency model fit within community care? And how is CRM being brought to the ECU and Greenfield community?
Well, so the community resiliency model, otherwise known as CRIM, what we really do in there is try to help people develop their empathy. A lot of what it comes down to. We try to raise awareness around adversity, stress, and trauma, and how that affects the developing brain, but also how it affects all of us, how it can show up behaviorally, socially, emotionally, how we respond, and really helping people to understand that it's a very natural, normal reaction to stress and to trauma. And so it helps us to shift our perspective from, thinking what a lot of times we might say about other people, ourselves, like what's wrong with me, what's wrong with you, to really think more of what's happened to you or what's happened to me to get me to this place to make me be reactive. And especially whenever these very stressful situations and trauma and adversities can happen within our childhood, it actually rewires or I shouldn't say rewire, it wires our brain differently for us to be, I would say, more reactive to stress. As we go through as adults. And so just that basic understanding can create communities that are more compassionate for one another, that have that empathy to where we're not walking around just blaming other people. We have this understanding that, people are suffering and doing the best that they can. But then what we really try to do is to even shift that one step further to think more strength-based and resiliency-focused, to think, well, what are your strengths and what's getting you through this? Because we operate within these systems that are all focused typically on the problems, the issues, what's wrong, and we try to fix those things, but shifting that to really think more of what is right within our community, what are our assets, what are our strengths, and how can we really foster those attributes and those characteristics in each other is I think helpful to help our communities come together and to heal, because unfortunately we're never going to be able to completely take away all of the adversities, but we can kind of counterbalance that with protective factors and positive childhood experiences, and just supporting one another as a community. And that has to happen outside of the individual, that has to happen outside of the family, that has to happen within one's community.
Thank you. Next question I have for you is, what role do you think community care can play in promoting population health?
Well, if we think about, community care as this collective collaborative effort and how we all come together, one of us cannot be well if all of us are not well, right? So working together to help ensure that everyone's needs are met is, where we're most likely we're all gonna do better because of that. So going back to the kind of we're only as good as our weakest link, so making sure that we're helping everyone to be successful and to thrive. There are many benefits to social connection. It's documented, it's been researched. We have, for our mental health, increased happiness, better health, longevity. We live longer when we're happier, when we laugh more, when we have community support. So the social connectedness is key to all of this, even down to our physical health. There's been lots of studies, but I'm thinking of one in particular, and it was the American Journal of Lifestyle Medicine, I believe, where it was documented it decreases depression. Just having that social connectedness, it helps us to maintain healthier weight even. We have lower blood sugar levels because when we're stressed, our body is preparing for action, so it's dumping that glucose. Slowing our heart rate down, we're going to help to improve heart health and hopefully have fewer people have different types of cardiovascular disease issues. So, but apart from that individual help, really thinking about our community caring for itself, caring for others, we also have to imagine other less tangible benefits in terms of our systems. I believe that with community care, we can really come together and think about the systems that are in place and how we can improve those systems, in which are going to support every single community member. So going back to what Dr. Matthews had said about the systems that are in place, in terms of community care, we have to think about, and population health, we have to think about our most vulnerable populations. So thinking about our marginalized community members. A lot of times our marginalized community members are expected to just, engage in self-care and navigate these systems that are in place that really were put into place, if we can speak openly here, which I'm getting ready to, I guess, which oppress certain groups of people, right? And it's not going to break down, a self-care day, taking a day off. I'm going to go have a bubble bath. Like, yeah, that's great. And we should all do those things. However, it's not going to break down these barriers to wellness and to being healthy, if all of these things are still in place. So we have to get out of this idea of this individual self-care that you can tackle the world with this. Instead, it's going to come down to communities. It's commitment and practice of community. It's us caring about ourselves, but also each other, to foster health, to foster healing within our most vulnerable population. So it helps us, community care will help us to really address and focus on where there are gaps, where there are needs, and empower us to really take action, to not wait for organizations or governments to come in and see and help us, but to recognize that we have the power within our own communities to help and heal.
Thank you. Thank you so much. Next up, I'll be asking Dr. Christina Bowen, does any current initiative you work with at ECU Health to promote team member, provider, and community well-being align with community care?
Yes, absolutely. So one of the things that we do is we're very intentional when we think about well-being. And I first have to say I'm boarded in integrative and lifestyle medicine. I feel like I'm with my people on this call. I'm like, yeah. I want to give a shout out. So we're very intentional in taking a holistic approach when we think about well-being. And I love what you're saying about the vulnerability of our population. So we use the social vulnerability index. We're very conscious of the social determinants of health, not just when we think about our patients, but when we think about our team members and taking care of our community at ECU Health, right? And so we're very intentional in taking a holistic approach. So we start out focusing, we've got a wonderful partnership with the Employee Assistance Program with our licensed clinical social workers, and we do something called wellbeing pop-ups, where we go to the units, we go to clinics, we go in the hospital, and we check in with individualized teams, and each person gets a 5 or 10 minute check-in, and we just listen and check in with them. And it's really, I love what you guys are saying. I feel like we got to get away from self-care, because some people are like, I've got to take care of this before I can even think about myself. And so we're really intentional in thinking about, financial. We hear there's a lot of people that need help with their financial well-being. So financial, physical, spiritual, environmental, community. So we ask all of these different areas, and that's been really helpful for us to develop some of our programming that are positively going to impact that community of team members at ECU Health. So one of the things we heard was we could really use some more education around financial well-being. So guess what? We now have workshops on financial well-being. We heard people were like, I really want to grow. This has been really empowering. I feel connected to my purpose during the pandemic. Could we have more leadership opportunity? Yes, that's part of it. So really listening to the community and what they need. And as a lifestyle medicine doctor, I'm not going to answer my next question, Muhammad, because I'm going to go into what am I most excited about. But, we're trying to help our team members, our community, to create this holistic approach to well-being where they thrive at work. And we changed the lexicon at ECU Health from work-life balance to life-work balance. Like, we recognize that you come in with a story and a whole life outside of here, and it's probably your A1 is what I call it, your number one priority. And so really being intentional on that and focusing on how do we help our team members, and this will go into my next question. As a lifestyle medicine doctor, I think in Eastern North Carolina, we know we have a really high chronic disease and cancer. And so there are a lot of ways that, as you were saying, Jennifer, we can prevent it. We got to screen for it. And how about let's start really preventing it from a community standpoint and really education standpoint, super definitely public health. So I'm really excited because I see our individualized work that started in the pandemic, which is really creating this community that's going to help ECU Health in Eastern North Carolina, I really believe, thrive in the next 10 to 20 years.
Thank you so much, Dr. Bowen. All right, so next up we'll be going to Dr. Erin Roberts. We'll be asking you first question to start off with. With the burden COVID-19 has taken on mental health, are there any suggestions you have for integrative and community care to address the growing mental health burden?
Yeah, I would say that is a really important question to consider, because I know that we have definitely felt kind of the burden kind of that COVID has caused on everyone's mental health. Even at the ECU Family Therapy Clinic, we have had the number of hours of therapy has doubled in the last just year alone, and it had doubled the year before. And so more and more people are accessing mental health. And so, one of the things in considering this is, first of all, is to really apply kind of universal precautions in creating kind of more like therapeutic settings. And so what I mean by that is that a lot of times we talk about like trauma-informed care, or creating spaces where we are helping those who are experiencing mental health crises, or are experiencing really kind of a lot of stress to their system. And we talk about them and kind of that almost in that you all and that kind of other. And what we need to start to do is create kind of those we all spaces where we are applying kind of universal precautions and creating more therapeutic spaces, which I know all of my colleagues here have talked about overall, and doing that in the schools, doing that at ECU. And so kind of launching into that second question a little bit, I'll just touch on, but with the Resilient Pirate Nation initiative that I know Dr. Matthews and MSPH is involved in creating some spaces at ECU where we're looking at kind of we're looking at policy, we are looking at classrooms, we are looking at workspaces, and trying to find more ways to create a therapeutic environment, right? And I think also concentrating as a whole community on how we're going to spiral up kind of through this, right? Because it feels, there was this great image, and actually I have it here. I think it's been like copied like 3,000 times. And so I have these like little spiral up and spiral down that I have hanging up in my office, right? But it talks about kind of the road to kind of spiraling down, and there has been so much stress kind of on the whole system, and that is not just on the individual, right? It is on our, we have all experienced this worldwide pandemic, and each of us has experienced it in a very different way. And we see things are coming out kind of in different ways for different people. So for some people, it may come out as being really irritable, right? Or for some people, it may come out as being very fearful and like, that we have to have things a certain way. There are so many different ways that this is coming out. So, we're in this kind of spiral down kind of or spiraling kind of process in the system. And when thinking about it, I almost thought about the image of back in, well, like kind of like a merry-go-round, but not like the safe ones they have now, like the ones from the 80s, the heavy metal ones, where like you get it going fast enough, someone's gonna like spin off, right? So like that is where we're at. And so like in order to be able, we got to, as a community, find a way to slow that down, right? And to stop and be still. And one of the things that I thought, when looking at this, like it's called the emotional guidance scale, that the at the top of the downward spiral is boredom, and at the very bottom of the spiral to go up is contentment. And so, and if you look at boredom and contentment, they are like, from the outside, it can look very similar, right? It's just kind of how do we stop and be still and help one another to be able to then get that merry-go-round going around the other way, to be able to spiral up as a community where we support one another. And so, yes. And so for family therapy, and I'm a big relational person, so these are my people as well, right? How do we, what we look at every day is how do we connect and help people to learn how to connect with one another relationally. And that's just not for like an intimate partner or, romantic interest, or even your kids, right? It is how do we help people connect with other people, your coworkers, the person at the grocery store, the person who, flipped you off in the parking lot. Like how do, how do we learn to connect with one another? And I think that is how I think we're going to slowly kind of dig our way out and to spiral up. And of course, with a lot of like some policy changes too, to make sure that that all mental health, those who are licensed in mental health treatment providers are able to provide treatment for everyone, including the Medicaid population. So those are kind of my I might have answered both of my questions, Mohammed. I'm so sorry.
No, you're totally okay. So yeah, the next question I had to ask for you was what initiatives are you aware of or involved in to address community mental health at ECU and for community members in ENC?
Yes, and so yes, so the Resilient Pirate Nation I will mention, and then one that Dr. Matthews also mentioned too, the Thriving Families, and that through Thriving Families and being able to have the support through Thriving Families, so we're able to offer, so for every client that comes to the family therapy clinic, we're able to we don't do insurance, so we serve a lot of underinsured or uninsured, and it is an income-based fee. But that through support, through, that support, we are actually able to waive the session fee for a lot of people, and a lot of, so they don't have to pay for their therapy sessions. So the Thriving Families program, the Resilient Pirate Nation, which I would encourage anyone at ECU who is interested to join us with that. And I also want to mention there are a lot of clinics at ECU too, such as the Navigate Clinic, Counseling Center, the PASS Clinic. Counselor Ed has a clinic too. Their name, I think it's their name is escaping me at this point, but where people can go to, and that, just being able to process all of what we have gone through. McClammy, thank you, Lauren. The McClammy Lab. Just we all have been under a lot of stress. And to be able to go in and have some time to talk with someone and process through that stress, I think is enough of a reason. Like if you don't need a reason to go to, but I think that is that can be a way to kind of help to connect, to be able to just sort through all of what has happened.
Thank you for sharing those resources and your responses. Um, so for everyone, we have a few minutes left. So we'll be doing a quick lightning round with all of our panelists again. So this is a question that I'm going to ask all the panelists, and we'll just go one by one. But if you have one takeaway from today's chat, for our members of the community attending, what would it be? And I'll start off with Jennifer Matthews.
So I hope that the people attending this understand the need for empathy and compassion in anybody that you can come across. I often tell people when I talk about this that we are all icebergs carrying suitcases, and I'm only going to show you as much of my iceberg as I want to show you. But no matter what, my suitcase full of all my experience goes with me. I can't leave that suitcase anywhere. It comes with me. So whenever you come across something, my mom happens to be retired and works at a local grocery store in town. And there's just something about her, the stuff that people tell her when they come through her line. And sometimes like she gets really disgruntled, and I'm like, Mom, you don't know if the person, I mean, unless they share it, that how do you know that they didn't get like the worst news ever and now they have to go by the grocery store to get milk? I mean, you just don't know when you're coming across anybody what they might be coming from or where they might be going. So just meet them where they are and offer kindness. I really feel like a lot of this is just about being kind and recognizing that we are all humans experiencing things. And that really is very important in looking in a community and recognizing that as a community, we need to provide supports for everybody in our community. And what that support looks like might be different for me as it looks for other populations of people. And that's okay. But that the support is there is really needed. So hopefully a little of that came through probably a lot of that came through in this discussion today.
Thank you, Dr. Matthew. That was very beautifully said. I'll be asking the same question next to Dr. Bowen, please.
Yeah, just to piggyback off that a little bit, I think, the importance of story is something that we all need to pay attention to. Our own story, so that suitcase that we're carrying with us, acknowledge the suitcase and really acknowledge that others also have a story and embrace it, like you said, with compassion and understanding, and really that sense, like you were saying, Laura, that we need that. That's one of the things that's going to support our emotional well-being, is to recognize our story and those of others and listening to those, because it helps with those relationships, that social connection, which is directly tied to both our physical and our emotional health. And really, like you were saying, Dr. Roberts, I think it's so important to just have safe spaces to talk. So you can be your authentic self. You can unpack that suitcase and really feel like, I love the upward spiral, because we talk a lot about post-traumatic growth, right? And so really creating that upward spiral in your life and that of your community. So, and I really thank you for letting me be on this panel. It's been wonderful.
Thank you so much for sharing. All right. Next, Dr. Roberts, please.
Yeah, I would echo it. Thank you so much for having me on this panel as well. And I guess a few of the takeaways are, if we are going to kind of do that spiral up, that, to kind of keep in mind, like the whole that we are a part of that. And I think that helps keep us from the you all approach, because I think that there's one thing as far as like the self-care, but then there can also be a little bit of danger to go into the like, okay, you all need self-care, right? And leave us out of that community connection, right? And that kind of keeps it from it being more like almost a stair step, like you all need it, versus kind of that circle where we all can connect in order to be able to spiral up. And so I think that may be I guess the takeaway. So
Wonderful. Thank you. All right, next, Ms. Church, please.
So I think one of the biggest takeaways I would hope is the need for connectedness, that relational health piece, really to recognize that that we all need that as humans. I often say we're social critters and we need each other. Some of us are more introverts than others. The extroverts usually acknowledge this, but people like me who are more introverts, it's like I've got this on my own. But recognizing that it's not just me. Whenever it comes down to my own health and wellness, even it is the community in which I live and work and play and serve, and I interact with on a day-to-day. So I think that connected piece, and that is, within your family, building that connection. Once again, with all the technology, it's really easy to stay connected to the technology, but not each other. Recognizing we need to put that down and connect with one another, just having conversations. The same thing in our classrooms with our students, taking time. Sorry, I muted myself. Taking time to check in, even just asking how someone's doing. Instead of just starting class with rolling out what you're talking about and the objectives for the day, just that check-in, and helping, like, for example, our students to understand the importance of that as well. Really looking out for one another. Some students may be here all by themselves and not have any friends or family. So I think it's especially important then, but also with our colleagues, recognizing we're not sure what's going on in people's lives outside of work. And just giving people grace to maybe mess up and say the wrong thing, and still embracing them and supporting them. So in addition to, within our own communities and our home lives, and our neighborhoods. So the other thing I realized I forgot to talk about the CRIM workshops and how we bring those. So I would like to say that we do offer CRIM workshops pretty much every month here on ECU's campus, and we usually send that out through ECU Announce, and we've been trying to plug in and put some flyers out. So if any of you are interested in that. And then also going back to the Resilient Pirate Nation, we do have work groups, and Jennifer, I'm going to say that to you. If anyone would like to come and join, Jennifer, do we have a meeting scheduled? Because we would love to really have longer conversations around what we can do and action steps here on campus to build a more resilient, thriving, compassionate campus.
So we don't have a meeting set right now, but I will tell you that it will probably be at the beginning of December that we will have our next meeting. And feel free to email me if you would like to get on the email list for that. We also send those out over Announce as well, but if you would like to receive the information directly to you, then feel free to email me. I'm happy to put you on the list.
All right. Thank you so much, everyone, for answering all those questions and going through that. Now we'll be moving on to taking audience questions, and it's time to take audience questions. So,
All right, we'll turn it over to Soph Myers-Kelly, and they will be going through the questions that have been posted on chat. Thank you, Soph.
Hello, thank you. What a wonderful conversation. I'm glad I could be here for it. Before I bring up a question, I'd like to briefly address the great chats that we've been having. There's been dialogue and discussion about what we can do after this, what steps we can take to share information that many had no idea about, the clinics or benefits available, the sliding scales. So we will discuss building a resource guide or whatever the next steps are for engaging with the community as leaders to have better community care. So thank you all for those questions about that. And a small follow-up related to that is, can we get emails with links with some of these resources? So that's more of a question for my teammates and presenters. If perhaps you can email some of the resources that you've referenced to us, that would be helpful. And then a question for, oh yes, someone unmuted, hello.
Oh, no, I was just saying, absolutely, yes.
Awesome. Yeah. And then a question for the panelists from Carrie Forbes. Do you think there will be lifelong trauma or emotional health issues for students who went through the pandemic with the shift to online classes for over a year and then back to person, etc.?
That is a great question, Carrie. And and I think in looking at this, everybody experiences how they process kind of trauma is very individualized. And so I think that we need to kind of look at yes, we need to look at, students. I mean, anyone could have lifelong trauma or emotional health issues due to the pandemic. And I think that we need to pay, close attention to students. I think we're already seeing some of the impacts, of students that has had on students as they are coming in and what they are sharing. And so we need to make sure that those resources are available to students, and that we have people that are close to students, whether that is faculty or staff, the physicians that are all kind of asking those questions to make sure students are all right now. But I would say it probably is very individualized what kind of impact, if that will be lifelong or not. But it was incredibly stressful for students, and I think that needs to be validated. And I think also it was also stressful for staff and faculty, and there's stressful for just as a whole community. And I think that, also in marginalized communities, right, the impact, I mean, we need to be looking at the impact on marginalized communities and what kind of lifelong impact that might have too, because the impact, I think, could be even greater on marginalized communities. So I think that, I'm sorry if that's not a very specific answer, but yes, I do. And I think it also just depends too. So, yeah, I don't know, Jennifer, if you had a thought on that.
Yeah, I do want to just say one thing. I think that if even if you don't see lifelong impacts, right? I think that one of the things that did happen, but it brought to light the gaps that already existed and the need for us to build resilience into multiple sectors. Like a part of the community resilience model training is teaching emotional regulation. I don't know how many times a day I say to people, we tell kids, I have 2 6-year-olds and an almost 4-year-old, you learn your emotions, but they have no idea how to regulate those emotions. I was never taught how to regulate those. And so when we are in a system upon systems where some of this dysregulation occurs, it really highlighted the need in COVID to help build people's ability to build resilience. No, we are not born with enough resilience to get us through life. It is a muscle. You have to practice it. But doing this and having a community that helps support doing this is what I think came out of COVID. And what I'm hoping people will take, and we're starting to already see some of this need to grow resilience and to work out that muscle, just like we work out every other muscle in our body.
Indeed.
Yeah, I will share, a lot of it comes down to the resources. I mean, especially with our most vulnerable populations, a lot of times it's just the lack of resources. So really making sure that the resources are in place to support people when they're needed is going to be important. But, while there have been negatives that have come out of the pandemic, to the point of post-traumatic growth, also recognizing that we can grow out of these experiences, and I don't want to say that lightly, but because if there are people who are struggling, I don't want to kind of sugarcoat that, right? But there can be growth out of these types of experiences, and really focusing too and helping people to shift their focus. Yes, this was a really hard time, but what else is true? What were some of the strengths that came out of this? What were some of the positives? What were some of the things that you did? Because what we also saw on the other side of this was a lot more connectedness within our family units. So I like to just kind of point out that there is also something else that is true. Thank you.
I think, sorry, go ahead, Dr. Bowen.
I'm going to say one of the things that we have been, just to based on what you said, and by the way, my kindergartner, he's now 1st grader, has a community resilience teacher that comes to his class. I love it because he tells me how he's regulating his emotions. It's amazing, Dare County. But one of the things we've really been intentional in talking to team members and in our community at ECU Health is this whole concept of surviving versus thriving. And so to me, that's because we heard from them, one of the things they said was, I am resilient, I'm still here. And so we said, okay, yes, and you are so resilient. And now we want you to be thriving because you did a great job surviving and being resilient. Let's thrive. So just that whole post being where you are, like you said, but that we really can grow from this.
Yeah. And I loved that you all touched on that too, because yeah, it also, brought to mind too, like the other piece of that. And that is that, yes, there could be lifelong trauma or emotional health issues, but we also forget the brain is so amazing and it's very plastic as far as the neuroplasticity. So it used to be the thought that, okay, if you had trauma and that it impacted your brain, the brain can't really, rewire and whatnot. But now, we know that, yes, okay, so if you maybe don't do anything about kind of that impact of trauma, you never process it, you never kind of do things to thrive, to be able to spin back up, that that you could have lifelong effects. But what we know now is that you can do things, and I think CREM is a great way to learn how to deal with your nervous system and be able to have an operator's manual to, this is my nervous system, these are things I can do. Here is where I can process with a friend, with a therapist, with healthcare provider, right? And so there are things that we can do so that somebody doesn't have to experience the impact of trauma and emotional health issues their whole life.
Thank you, everyone, for those thoughtful and wise answers. And we are already a little over time. Wow. So to be respectful of everyone's time, I'll pass it back to Mary. And thank you, everyone who attended.
Thank you so much for sharing your expertise, and that's wonderful. Great responses. Thank you. And thank you for attending, all the attendees. Thank you for attending. And I will put up a slide. Now you can email Jamie Bloss with any feedback or questions that you might have. So thank you, Jamie. Did you want to add anything else?
No, thank you all so much. I love the conversations today and the chat and everything. So thank you all for coming. We will be recording this and putting it, we recorded it. We'll put it up on our Laupus Library YouTube page, and hopefully we can get some resources together for everyone too. And thank you everyone from the community, especially who attended today. So thank you all so much. Have a wonderful rest of your day.
Thank you. Bye.
Thanks, everybody. Have a great
Thank you
week.
so much.
Bye.
Okay.
Bye-bye.